All right, let's talk about this. If your child's doctor has mentioned getting an ECG, that word alone can sound a little intimidating, right? But I promise you, it's actually one of the most common and safest tests out there for kids. So, what we're going to do is break down exactly what an electrocardiogram is so you can walk in there feeling confident.
Look, it's totally normal to feel a bit anxious when it comes to any test for your child, especially when it involves their heart. So our goal in the next few minutes is to just wash away that worry and replace it with some real practical knowledge about what's going to happen.
So first things first, you're probably wondering, why does my child even need one of these? Let's go over the most common reasons a doctor might suggest it.
A lot of the time, it's to investigate certain symptoms. Maybe your child has had dizzy spells or even fainted. Or perhaps they've mentioned chest pain or that weird fluttering feeling. You know, palpitations. It's also a go-to test for things like getting out of breath really easily during playtime or if they just seem more tired than usual. These are all good reasons to just take a peek at what's going on.
But, it's not always about symptoms. An ECG is a really fantastic screening tool. Sometimes it's done before a child starts playing sports or as just a routine check before a surgery. And it's also really useful if certain heart conditions run in the family. It's all about being proactive and making sure everything's in good shape.
Okay, so that covers the why, but what actually is an ECG? What is this machine doing?
The easiest way to think about it is this. Your heart has its own electrical system that tells it when to beat. An electrocardiogram, sometimes called an EKG, is basically a listener. It doesn't send anything into the body, it just listens to and records those electrical signals. And that recording creates the classic rhythm, that wave pattern we all recognize, giving doctors a really clear picture of how your child's heart is working.
Now, for the part I think is going to bring the most peace of mind. What actually happens during the test? I'm telling you, it is so quick and so simple.
So here's how it goes down. Your child will just lie down and get comfy on a bed. A technician will then put a few small sticky patches, they're called electrodes, on their chest, arms, and legs. They're just like stickers. Then all your kid has to do is lie still and breathe normally for a couple of minutes while the machine does its thing. That's literally it.
And the big question, how long are we talking? The entire process, from walking in the room to being all done, is usually just 5 to 10 minutes. Seriously, it's often over before they even have a chance to get bored.
But here's the most important part, the stuff every parent wants to know. Is it painful? Are there needles? Is there radiation? And the answer is a big, resounding no to all three. It is completely painless. There are absolutely no needles involved, and there is zero radiation. It is one of the safest medical tests you can imagine.
So, for a test that's so fast and easy, what can it actually tell the doctor? Well, it turns out a whole lot. It gives them an amazing amount of information.
An ECG can help a cardiologist spot a bunch of different things. It can show if the heart is beating too fast, too slow, or just irregularly. It checks for what are called conduction problems, which is just a fancy way of saying it checks how those electrical signals are traveling through the heart. It can even show signs if parts of the heart are enlarged or help screen for certain inherited conditions.
So when you put all this together, you can see that an ECG really isn't something to worry about. It's actually a really positive and powerful first step.
Really, the best way to look at it is that this simple test is the first step toward getting answers. It gives doctors that baseline information they need to either tell you, hey, everything looks great, or to figure out what the next best step is for your child's care.
And if the test does show something a little unusual, that's not a moment for panic. It's the beginning of a clear plan. Your doctor will talk you through everything, explain what they see, and discuss what comes next. And that might just be another simple test to get more info. You are not alone in this. You'll be guided the entire way.
So while it's so easy to get caught up in the worry, the real point of an ECG is just to provide answers. It's an amazing tool that takes uncertainty and turns it into understanding. Because when it comes to your child's health, the most powerful tool you can have isn't some fancy machine, it's clarity.